there's an ethical component to this as well. And we shouldn't allow a situation where a potentially life-saving or life-changing therapy doesn't get into patients who might need it.
No, absolutely. I mean, so there's two aspects of this. One is, I remember when I first started to get involved in the drug development business, often I was really pushing always for that metric of first patient in. Get that first patient in as possible. But actually, that's the wrong metric. The best metric is last patient in, because you can, anyone, even if you're not very smart drug, not very smart study, you can get that first patient in by doing a protocol which is full of errors, opening at least one site somewhere and getting one patient in, and then you've started the study and you're happy. But then a very seasoned line manager of mine once said, actually, it's last patient in most important. You should spend more time preparing the axe before cutting down the tree, because you can then have fewer protocol amendments, patients get recruited much quicker, data quality gets quicker, and actually the time to last patient in is when you can then do something with the data. This is both on a commercial perspective, but also on a patient perspective. And the other aspect is, especially if you've got some new science that's come out and the new pathways have been identified, be that in cancer and immunology, etc. And suddenly you've got 4 or 5 medicines being developed almost in parallel by different companies around the world in that specific area. At the beginning, you have clinical equipoise, i.e., the ethical thing that when you randomize patients to this new treatment or to existing treatment, you generally don't know what the outcome is going to be. So it's ethical to randomize patients to the study. But as studies go on, and as some start lagging and the first ones start getting reported out, you start getting into this gray area where maybe that clinical equipoise around that class of medicines becomes a bit more questionable. This does two things. One is ethics committees get very worried about this. Patients stop wanting to be randomized in those studies, and it becomes harder and harder. So getting your study completed as quickly as possible with the best quality in advance of competitors actually also has an ethical issue. And at the end of the day, you have an awesome responsibility for the patients who've donated their time and energy and health